Hi, everyone. I'm Annabeth. I'm a research coordinator that works with Dr. Martin doing research at the OB Motivate Clinic. And I wanted to tell you about a new study that we're starting called Project Better. And it's a clinical trial that we are going to be starting recruitment for very soon. This study was born out of a clinical need and really designed to help our patients. So we all know that having a baby is really hard for anyone, especially our patients who are in recovery. And three of the things that our patients have told us that make the transition from pregnancy to postpartum particularly hard are the physical and mental challenges that come during the postpartum period, concern for their infant developing withdrawal symptoms and or caring for an infant who has withdrawal symptoms, and being underprepared for interactions with child welfare or CPS. So we hope to help prepare our birthing parents for this postpartum transition and help them maintain their recovery during this really difficult time by providing education on each of these three topics using either technology-based modules or a brochure. So you can see here, this is an example of what the brochure looks like. And then here is just a picture of what one of the modules looks like. And the modules are led by PD the Parrot, who you can see here, and they have interactive questions and videos of different providers and patient testimonials. So I'm going to exit out for a minute and just show you a clip of an example from the NOWS module. So hopefully this will work on my screen. All right, so we'll just show this.
All right, Mom, so we're looking at sweet little Ava, and we're trying to notice a few signs of withdrawal in her. And so what are some things that you're seeing that you've learned about?
She is very fidgety and she sneezes a lot. Sometimes she's inconsolable.
Okay, and that's really important for a parent to notice so that you can learn how to console your baby, and you've been practicing it here in the hospital and doing a really nice job. So one thing of the sneezing you mentioned is something that we commonly see in a baby who's having some withdrawal symptoms. And one thing I want to demonstrate is just that when we pick up Ava here with her arms, her head kind of comes in line with her spine, which is not an uncommon finding for an increased muscle tone in a baby who is having some withdrawal symptoms. She's rooting around, so that's a normal baby finding. She's just ready to eat. And
all right, so we'll just pause it there and I'll go back to my video here. So there you can see just a brief clip of an example of the videos, and the modules are filled with videos like that that provide really helpful information for our birthing parents. All right, let's see. So we will be recruiting pregnant people and following them through 12 weeks postpartum. So if you see any of our team in the clinic, that's what we're doing. And you might see some of our study flyers outside exam rooms for potential participants. It's very important to our team that we do not interfere with clinical care, as that is the top priority. And we don't want to add any more to your already very heavy workloads. So if there's any issues on that front, please let us know at any point throughout the study. Participants who choose to participate in the study will be assigned to one of two conditions that I mentioned earlier, either the modules or the brochure. And we are asking that our participants do not share which condition they're in with the clinical team, so it won't impact clinical care. And we need to keep that information quiet and not tell Dr. Martin until the end of the study. So if a participant shares what condition they're in with you because they're really loving it or for whatever reason, please just don't share that with anyone else on the clinical team. I think that's all the information that I was going to cover. So if you have any questions at all throughout the study or concerns, you can talk to Dr. Martin or myself or any of the other RAs that will be in the clinic, research assistants who will be in the clinic. We're happy to speak with you about our study. So I'm going to close out of this and so you can see all of our faces and get to know us a little bit. Okay. So I'll let everyone introduce themselves.
Hi, I'm Andrea, and I'm a research assistant for Project Better with Dr. Martin.
Hi, my name is Sarah. I'm another one of the research assistants working with Dr. Martin.
And I'm Michelle, the last research assistant working with Dr. Martin.
Well, thank you, everyone. And again, like Annabeth said, we're really excited to start this study. It's been a few years in the making to get this going. And this was started because pediatrics and OBGYN and other specialties all got together and wanted to solve a patient-reported need. So thank you again for your help. And please do reach out to us if you run into any questions, concerns, or just want to learn more about the study.